Health, rights and well-being is a really practical toolkit for programming on HIV and sexual and reproductive health with young key populations in Eastern Europe and Central Asia.
Young people that belong to key populations are particularly vulnerable because of the widespread stigma, discrimination and violence.
We developed this toolkit together with young key populations. We had a whole series of focus group discussions in 8 countries, so it's really engaging with them and for them, and it's a very, very practical way of ensuring their rights.
I have been actively involved in the organization of focus group discussions for young key population groups in Albania. I have also had the privilege to be involved in the development of this practical tool.
I was a part of the data collection process for development of this tool, and I'm happy that I made my little contribution in order to make it more comprehensive.
So the guide has been developed for public healthcare professionals, health workers, of course also for managers of HIV and SRHR programs, for NGOs, including community groups. I'm convinced it will also be of interest for international funding organizations, as well as both for advocates and decision makers.
The toolkit describes the situation faced by young key populations in the region. It explains the policy and legal context. It provides examples and tips from this region, from young people themselves, but also from further afield, to make it easy to deliver what's contained in the toolkit.
This evidence-based tool leads to meaningful inclusion of young key populations to general HIV and sexual and reproductive health and rights programs. I'm convinced that this tool will help to effectively address the challenges on sexual and reproductive health and HIV issues of young key populations.
I see this tool as a strong advocacy instrument to push for the development of meaningful programs for HIV prevention and sexual and reproductive health and rights for young key populations.
I'm very excited with the launch of this tool, and I'm convinced that it will help all of us working in sexual and reproductive health and rights to support young key populations.
I hope it's a really practical tool for all of those who have the courage and commitment to work with young key populations to ensure that their rights are met, that discrimination is stopped, and that they can fulfill their potential.